Hi, this webinar is now recording and is streaming live on YouTube as well as the Culpeper Media Network. There are 2 access links for anyone who wants to join on the regionalcollaborative.com website. This is the Transportation Options for Aging Adults webinar. My name is Kristen Peraza. I am the Mobility Manager for the Regional Commission covering the 5-county area. And I'll be moderating the panelists in the webinar. First, we have Sue Davis to introduce the webinar and explain a little bit about how it will all work. Sue works for Aging Together, and she is our volunteer recruitment and outreach coordinator. Sue, go ahead.
Hi, everybody. As Kristen said, I'm Sue Davis with Aging Together, and I'm here with all my partners. And our main goal is to find volunteer drivers to help people, older adults, and the disabled to get to their medical appointments. And as you can see from the screen, there's a lot of information right there. But if you need to ask us a question, just type your question in chat, or you can, and one of the monitors will pass it on to whoever is presenting at the time. And if you're on a live stream or a recording, just simply email your question to me, Sue Davis, or S Davis at agingtogether.org, and I can respond to you. Now, if you're watching this on television, on the local channel, you can give me a call at 540-505-5900 and get in contact with me, and I can answer your questions or direct you to the person who can. And next week or early next week, all of this information will be on hopefully a lot of our partners' websites and also on the regionalcollaborative.com. And what you'll do when you go in there, it's very easy directions. Just go straight to services and data, and then scroll down to the information section. And all this information will be there again. Because today you're going to hear some new information, but you're also going to hear some old information that is worth repeating, and that's that we need volunteer drivers.
Thank you, Sue. Next up, we have Penelope Thompson, our mobility coordinator and accessibility advocate for the FAMS call center. She works for the Rappahannock-Rapidan Community Services Board and is an employee for the call center out of a partnership with the Regional Commission. Penelope?
You're on mute, Penny.
Sorry about that, everyone. Good afternoon. My name is Penelope Thompson, again, Mobility Coordinator and Accessibility Advocate with FAMS Call Center. I will be discussing with you some information on the call center today. FAMS was started in 2017, one of only 2 in the state. The call center provides free information and referrals for all available public, private, and volunteer transportation in the 5 surrounding counties, which is Culpeper, Fauquier, Madison, Orange, and Rappahannock. We also offer trip planning and support requests for gas or bus vouchers. An example for trip planning would be if a client calls in and explains their transportation needs. That's Marty and I, as mobility coordinators, will match the client's needs with eligible or available services and provide information on services needed. Information and services can be accessed via website at www.fams.org or by calling directly at our office at 540-829-5300. Our hours of operation are Monday through Friday, 8:30 a.m. to 4:30 p.m. If anyone has any questions, feel free to ask me. I have my website available to where you can email me any questions you may have, or here after the program. Thank you for your time. Have a good day.
Next, we have Marty Flattery. He's our mobility coordinator and community liaison with the Rappahannock-Rapidan Community Services Board and works collaboratively with Penelope at the FAMS call center. Marty?
Yeah, hi there, everyone. Sorry about that. My name is Marty Flattery, and I work at the FAMS call center alongside Penelope, and I will be talking to you today about our gas voucher program. Transit passes and gas voucher scholarships. The gas voucher program is our last safety net when no other transportation option works out for our clients. We offer the program in all 5 counties: Culpeper, Fauquier, Orange, Madison, and Rappahannock. And there are pickup locations in each county to make the program accessible to as many people as possible. There are no requirements for eligibility, so anyone is able to use the program if needed. With that being said, the program is meant to be a temporary solution for our clients and is also grant funded with finite resources, so we do have limitations in place. We offer gas vouchers ranging from $10 to $25, depending on the client's specific situation. 25 is the maximum amount allowed within a 30-day window. We also only allow gas assistance 3 months in a row and 6 months in a 12-month period. Now, all those timeframes are rolling timeframes. So if a client receives gas assistance on the 29th of a month, they will not be eligible again until the 29th of the following month. While most of our clients' needs fall within those limitations, we do understand that some clients, like clients with mental and/or chronic health needs, may need additional assistance. That is why we also offer the gas voucher scholarship. The scholarship allows us to give clients who need it more than, sorry, let me restart that sentence. The scholarship allows us to give clients who need it more than the normal maximum per month and is approved on a case-by-case basis. It is meant for clients who have prolonged treatments like dialysis, cancer treatments, physical therapy, among other things. If you are a community partner and have a client that you think may benefit from the gas voucher or scholarship program, please reach out to us at the FAMS call center and we can discuss what the best option would be available for them. Now on to the transit passes. The FAMS call center does traditionally offer transit passes to our clients who are able to take advantage of the public transportation options offered in the 5-county region, but who may not be able to afford it. Currently though, most of the public transportation routes in the 5-county region are running for free due to the pandemic. Once the fares are back in place, clients and community partners can reach out to us to inquire about receiving transit passes. Also, just like the gas voucher program, there are no requirements for eligibility, so anyone is able to receive a transit pass if needed. Again, if you are a community partner and you have a client who you believe may benefit from any of the options that I've talked about today, please feel free to reach out and contact us at 540-829-5300, or you can email Penelope or myself directly. That's all that I've got for you all today. For those programs, thank you for your time, and I will pass it back over to Kristen.
Yes, and we just wanted to take an opportunity to say thank you to our partners who have set up distribution points across the community. The PATH Foundation, the Rappahannock, Orange, Madison, and Culpeper DSS offices, the Fauquier Culpeper free clinics, and the Bealton Public Library, all due to their support, have allowed the FAMS call center to give away over 1,200 gas cards in the last 2 years. That totaled over $20,000 and enabled travel of over 58,000 miles for over 350 residents living in our community. That support has been invaluable for many people trying to access primarily medical supports and critical errands. Next up, we have Thomas Garnett. He is the healthcare manager in the Motive Care, which is formerly known as Logistic Care. Thomas?
Good afternoon, everybody, and thank you for giving me time to share with you information about transportation. Today, we're going to go through a little information about how to set up transportation through Medicaid. First of all, I do want to touch on the fact that our name changed. A lot of the community may know us formerly by a little bit more popular by our former name of Logistic Care, but effective in January of this year, our company actually rebranded itself and became known as Motive Care in January 7th. Motive is the Latin word which reflects for way, and it basically shares our desire to lead innovation and change in terms of how people are connected to their care. Next slide, please. So when making a reservation, there are a number of ways to do it. You can do the reservations or set up your transportation by making a phone call to us. And on this screen, and I realize we are on a tight schedule today, so I won't read all the numbers out, but on this screen, you have 3 phone numbers at the top for reservations. One is for any of our members out in the community that has Medicaid fee-for-service or DMAS coverage, and the DMAS reservation number is listed here on the slide. For any of our folks out there that have Aetna CCC Plus Medicaid, you'll see here underneath there the reservation phone number for them. And then for any of the members out there that have United Healthcare CCC Plus Medicaid, you also have the reservation number on the screen for there. In addition to setting up reservations by phone calling, you can also do it online through secure websites. You can go to our home web page, which is motivecare.com, and you'll see different, if you're a healthcare professional, you can click on the icon for that. If you're a member or a family member, you'll see a place for you to click on there. And then once you click on those, it'll take you step by step on how you can set up your reservation online. For any facilities like healthcare facilities that might be on board today, we do have a website just for them called Trip Manager, and Trip Care, and they can do it through there. And then there's also a mobile app called Logistic Care Trip Manager, and you can download that to your phone for free if you would like to use an app to set up your transportation. So there are a number of ways that you can make your reservations by phone, by going to a secure website, or using a mobile app. When you are setting up your reservation, there are a few things to have handy with you so that you can do it efficiently. We will need to know the Medicaid number for the member that's actually doing the transporting or needing the transportation, their name, their date of birth, the time that they need to make it to their appointment and what time they want to come back, the address and phone numbers, and we also need to know how they would like to be transported. For example, do they need to be transported in a wheelchair? Are they able to walk independently? What level of service they might need as well, if they would like to be dropped off at the curb or have the driver walk to the door with them. Or we also do offer hand-to-hand service. And what hand-to-hand means is that the driver would actually come inside to the facility and receive the member from somebody or drop them off to somebody. And then finally, what type of treatment? Are you going for day support? Or are you going for a doctor visit? Or do you need to go to the pharmacy, grocery store, or whatever that reason might be? Next slide, please.
Thomas, we have a question first. It says, what areas does Motive Care serve?
Yeah, so I realize that that we're probably talking to members here in 5 counties, but we cover the entire state of Virginia. So it doesn't really matter where you live. or where it is that you need to go. As long as you have Virginia Medicaid, we will pretty much transport you anywhere within the state. Great. So there are times, one of the questions comes up is if I need to arrange transportation, how much advance notice do I need to set this up? So for most of our members, we have what we call routine trips. These are going to be trips where you kind of know about them in advance. They might be like a follow-up visit to your doctor, or your 6-month checkup, or 6-month dental appointment. Those we do require 5-day notice, meaning that you give us 5 business days, so that we have plenty of time to put the trip into the system, and then also plenty of time to make sure we find the right company to take you. However, and I do want to mention, though, there are a lot of times that you will not be able to give that notice. You're not feeling well, or you call your doctor and they want to see you today or tomorrow. And those are what we refer to as urgent trips. So if you ever have a situation in which you need to see the doctor and you don't need to wait 5 days, or you would prefer not to wait 5 days, you can call the same reservation number and just explain to them that you're scheduling an urgent trip. And they will go ahead and set that up for you. So no notice is required for any urgent trips. For routine trips, we do require a 5-day notice. Okay, next slide, please. Trips, this is very exciting. Anyone that's new to Medicaid, or even if you haven't been new to Medicaid, you may not be aware that there have been some benefits or enhancements made to a number of the plans. And these plans particularly pertain to the MCO Medicaid plans, such as the CCC Plus plans. If you have Medicaid under the CCC Plus plans, a lot of those plans now allow for what we refer to as non-medical visits. And you can see here on this screen, some of those are listed. That would include being able to be transported to the grocery store. It would also include trips to the DMV office, places of worship, in fitness centers and gymnasiums. So those are just some of the non-medical places that you can now schedule transportation from. Each plan is a little different for these non-medical ones. They usually do have some type of limit that you're allowed so many of these type of trips per year. To find out, what your limitations are, you can certainly just call the reservation number and they can provide that for you. Next slide, please.
Thomas, we have another question.
Excellent.
They're asking, what about travel for employment?
Oh, that is a great one. And I feel like I should slap my hand. I can't believe I did not include that on this slide. So there are 2 types of employment. If it's just regular employment, like you're going to a regular job and it's one that you kind of secured on your own and you're kind of doing independent, typically it doesn't, but there is a type of employment called supported employment. And where that is where you would actually have like a job coach that helped you get the job and is kind of working with you to make sure that you're excelling in the job. So if you're in a supported employment situation, those are covered through Medicaid, and those are not, even though those are kind of not medical, typically those do not have any limits on them. So unlike the ones to the grocery store and DMV and all the ones listed on this slide, those you would be able to set them up for as many as you needed throughout the year. Excellent question, whoever had that. So so you might be asking yourself, well, this is great. I now can, make trips to go to my doctor or grocery store or pharmacy, what have you. But how do I get there, and what type of vehicles show up? So this screen is very, very extensive. It kind of, as you can tell, almost covers every type of vehicle on the road. I'm just going to run through them quickly. So basically, ambulatory type of vehicles are going to be like your regular taxis or sedan vehicles. Those are available to do transporting. And then wheelchair vans or vehicles that are designed specifically so that the member doesn't have to get out of the wheelchair. Those would be ones where they would, roll you in and then secure you in it, or a lot of them have what we call power lifts and can lift the vehicle, the wheelchair up, and then they just roll it in. So those are available. Also, van stretcher. Anyone who's not familiar with a van stretcher, it's like an ambulance without it's like an ambulance without the equipment on board. So they don't offer the full services of an ambulance, but they do provide the stretcher in a vehicle that would accommodate you so you could be transported laying down. And then of course, full stretcher is full ambulance services. Curbed, and then on top of that, then there's also levels of assistance. The levels of assistance tells the driver how much help you need once they arrive to pick you up. Curb to curb is for people who are pretty independent and they just need the driver to park the vehicle in front of their house or in front of the doctor's office, and the member would be able to get out of the vehicle on their own accord and be able to walk independently without any assistance to get to their appointment. For those clients that maybe need a little extra guidance, there is door-to-door assistance, and that's where the driver will get out and walk you to the door, but not go into the facility with you. And then finally, the highest level of assistance is hand-to-hand, and that's where the driver actually goes in and will retrieve you from somebody like a family member, or when they go to the doctor's office, they'll drop you off at the doctor's office where the receptionist or nurse can receive you. So there are 3 levels of service: curb to curb, door to door, and hand to hand. And when you're setting up your reservation, you just would want to indicate which of those 3 levels best meets your needs. Next slide, please. So during the trip, you may have members that need some form of medical or durable medical equipment. The companies typically do not provide these items. It would be something that the passenger would be expected to bring with them. For example, their own wheelchair. If they're bringing a minor with them, booster seat or child safety booster seat would be something that they would bring, or any other type of medical equipment. Now, I do want to put a footnote on here. There are some companies, either they're not required to do it, that do keep extra wheelchairs available for folks that need them, that are perhaps being discharged from the hospital and their equipment is at the home and then they didn't bring it with them, or that type of situation. So if you do need that, even though they're not required to, you can let us know and we can try to reach out and find a company that could offer you that assistance. Typically, we see that with the wheelchair particularly, but most of the other equipments they don't carry. Also, it's not uncommon for someone going on an appointment that might need to bring like a loved one with them. For example, you might have a single parent that maybe needs to bring their child or children with them. You may also have a person who needs a support person to go with them to help them understand what the doctor is telling them. So you can see here under additional passengers that you are allowed to bring typically one escort or one attendant, depending on necessary. Those are the ones that are allowed. If your situation is one where you might need more than that, we can certainly handle those on a case-by-case basis, but typically you're expected to bring only one additional person with you on your appointments. Next slide, please. So this is, I think, very interesting too, because a lot of times I find the general public is kind of self-taught themselves about, transportation. And so some people are aware that we can provide, taxis or wheelchair vehicles, but they may not be aware of some of the other resources that are available and that they can use to get to their appointments. For example, one of the, I guess, most common overlooked ones, which could benefit a lot of people, is mileage reimbursement. Medicaid will allow us to, if you have a neighbor or friend or a family member that you would prefer to ride with, you can let us know that at the time that you're scheduling the trip, and they can be set up to receive what we call mileage reimbursement, where they can get reimbursed a certain amount of money for taking you to your appointments. Typically, it's based off of mileage, so depending on how far you go, they'll get some form of mileage reimbursement. I know one of the questions that might pop up is, what does that look like? For most of the plans, it's 40 cents a mile. I will say United Healthcare has a little bit more robust. I believe United Healthcare's reimbursement rate is 54 cents a mile. And when we set it up, it's very, very user friendly. Whoever your driver is, we simply will mail them a MasterCard debit card that they keep, and then we put the money on the card, when they submit their paperwork for reimbursement, and then they keep the card. And if they do additional trips, we just simply keep adding money to the card. So it's very fluid. It doesn't require them to have a bank account or worry about the trouble of cashing a check. And it works out very, very well. And a lot of people really opt for that benefit. If you live in a city where there's a robust transit system like public buses, you can actually ask to ride the bus. And we do ask for people who would like to ride the bus to give us a little bit more notice. Typically, instead of 5 days, we ask for 7 days. And we can mail you bus passes. If you have a lot of if you have a lot of appointments during the month, what we might do is actually send you a month that would be good for unlimited travel throughout the entire month. So it just depends on how often you're going to be going on appointments. We can send you individual passes or send you a monthly pass if you're going to be out most of the month. And then we kind of went over the the things, but I do want to highlight that in addition to the regular vehicles, there also is we have a contract with Lyft. Some people actually end up paying for Lyft out of pocket. If they had Medicaid, we could actually send a Lyft company out to get them through their Medicaid benefit. And so that's another resource available. Now, Lyft does not offer the traditional services like the hand-to-hand and the door-to-door. So these would be for folks that could truly just benefit from the curb-to-curb service. In addition to that, we have volunteer drivers. I know y'all are certainly recruiting for volunteer drivers in your area. We actually have a network of our own volunteer drivers that could take you on your appointments. And we kind of went over the wheelchair vans and the stretcher and so forth. So I think we're pretty good on this slide. Next slide. So once you're at the appointment, you might say, well, that's great. I now know how to set my trip up, and I now know how to get there and what type of vehicle can take me. But what about when I need to get home? How do I do that? There are two ways that you can do that. If you have a trip where it's a particular time that you know you're going to be there, like you're going to see your doctor and you're typically only in the office for 30 minutes or an hour, and you feel that that's pretty predictable, when you set the trip up, you can not only let us know what time you want to be dropped off, but you can also let us know what time you would like someone to come back and get you. So you can put a particular set time for the appointment and a particular set time for you to be picked up. But for like a lot of us, you don't know how long you're going to be sitting in the lobby. You don't know if your doctor is running behind schedule. So what the other way, and probably a very common way, is simply just to leave it as an open time, or what we refer to as a will call time, which basically means that the company will drop you off, and then you will call us. You will call back the ride assist line, and you can see the ride assist numbers are listed at the bottom of this slide here for DMAS, Aetna CCC Plus, and United Healthcare CCC Plus. You simply call that number and call the appropriate number, and then once we receive your call, the transportation company has to arrive within 45 minutes to pick you back up to take you back home. So that's basically, so you can either set a time or leave it open and call us. And if you call us, the company does need to be there within 45 minutes. If they are not there within that time period, that's what we consider a late pickup, and you could file a complaint and we would hold them accountable. Next slide, please.
Thomas, there's a question. How
Great.
late will you pick up a consumer?
This is exciting. Just like the question about, are there limitations? We cover the entire state of Virginia, even occasionally out of the state, depending on how far out. But as far as the time, our business is 24 hours. So it's not uncommon for people to go to the hospital or go to the ER, and then when they're ready to come home, they may not have a ride home. And if they have Medicaid, they can call us and set up those trips. So to answer that question, there is no time limit. Whatever time you need. I know I'm working with a family in the Richmond area that they have a shift. Their shift starts at midnight and they don't get off work until 5 in the morning. So now I will say sometimes it's a little more difficult to find companies running at that time, but if you have a time that you need to be picked up, it's their job to find a company that will do it.
And there's another question. It says, do drivers receive dementia education or any other kind of training for interaction with their clients?
I love these questions. Thank you for, this is a great group. I really appreciate, these are really, really, really good questions. So the training that they receive, now these are not like counselors or healthcare professionals. There are professional drivers, but they do when they are decided to become a Medicaid driver. A few things I want to say. They go through a very strong screening background. We do their DMV screening. They have to do drug screening. They go through criminal background screenings. And then after they do the screenings and they pass those, they used to come into our office, but then something like a pandemic broke out. So we're not doing as many face-to-face trainings, but they do, just as we're doing a webinar today, they do go through an extensive webinar. And one of the things that we go through that we talk about proper seatbelt securement, what to do if they're involved in an accident, how to safely secure somebody in their seatbelt, whether they're in a regular seat or whether they're in a wheelchair. And then part of the training does go through what we call passenger sensitivity training, where they're addressed, or a section of it that talks about how to transport people with different disabilities, people who may be nonverbal and things like that. So they do get some training, but it's not as extensive as if they were like a case manager or social worker or a counselor. So they do get training. And everyone when you're riding through Medicaid, everyone should expect a safe and a courteous trip. If you get anything less than that, we would want you to call the ride assist to report that concern, and we will address it with the company and the driver if they're not professional with you. Very good question. Thank you for that question. So I alluded to how our training has changed because of COVID-19. Well, certainly some of our protocols for drivers has also changed. We want people to know what extra steps were taken to keep them safe during their transports. So one of the things that all drivers are required to do is wear some form of face covering, whether it be a mask or some other type of protective thing over their mouth and nose. And we also require the passengers to wear it as well. So if you're riding, you would be expected to wear it as well. Now, we do have a handful of people due to their disabilities that they're not able to wear a face covering, so that gets documented. And then there are certain drivers and companies that have agreed to take extra precautions to transport those members by themselves. So that's one step that we're doing. The other is that we're cutting down on, they can have other people in the car, but they're still required to do social distancing in the vehicle. For example, you would not be sitting on the same seat as somebody else unless that person came out of your house. Like, obviously, we're not going to separate a husband and wife or parent and child, but or even roommates. But if you're not coming out of the same household, we would expect them to be kind of spaced out in the vehicle, preferably on separate seats. And then after each trip, the seats and the vehicles should be sanitized, like the handles, the seats, and place, anywhere the person might have touched or should be wiped down and sanitized with proper cleaning solutions. Next slide, please. So if you have any questions, there is a 24-hour phone number that is available every day of the year that you can call if you have any questions about the trip that you have set up, or if you have a concern or a complaint. And so those numbers are listed on your screen here. Each plan has their own phone number, again, just like they have their own reservation number. You have the DMAS Ride Assist number listed, the Aetna and the United Healthcare numbers, and they will take your complaints. And even though I don't have a slide for this, we do take complaints very seriously. People say, well, what's the benefit of complaining? Well, we run a weekly report, and any of our companies that are not delivering high quality service end up on a report that could require action. For those who are not aware of it, we're required by the state contract that we have to make sure that 99.15% of all of the trips that we do every day and every month are complaint free. And so we're held to a very high standard. So we have to hold those same companies to that. And if they don't deliver, they could have their trips taken away. They could actually get fined, and other other corrective actions could be taken. You can also, if submit to us electronically. If you're a person that either doesn't do the phone very well or would prefer to do it online, there you can go at WeCare@logisticare.com, and there's a step-by-step guide to tell you how to submit like an electronic question or complaint through that website there. Next slide, please. Some last minute tips. These are just some really good things to keep in mind about transportation if you're setting up transportation for yourself or someone else. Please note that the transportation companies, under their contract with us in the state, do have a 15-minute window on the pickup times when they're picking you up at your house or wherever it is that they're picking you up from. This does not mean that they can be late to your appointments for 15 minutes. This is just on the initial pickup. So they are expected to deliver you to your appointments on time, but they do have a 15-minute window grace period. And that's to allow in case they need to drop somebody off or pick someone else up on the way. Members also have to keep in mind that if you are bringing items with you, like backpacks or other items, you need to safely secure them, during your lap or in your hands or arms. And that goes for not only what you bring, but as I mentioned, you can now go to grocery stores through your Medicaid benefits. So if you're buying groceries, make sure that whatever you buy, you can still safely secure it. And that's just so that those items don't get dislodged during a sudden stop and could, maybe, hit another passenger or be a endangerment to the driver. Pharmacy trips. This is a great tip. Most of the time when people are setting up medical appointments and they're seeing a doctor, especially if they are not feeling well and might feel like they're going to get some antibiotics or some type of medicine, it's a really good idea to go ahead and plan and add the trip at the same time that you set up your doctor trip. Because if you set it up at the same time, you can have a trip to the doctor and then have a trip from the doctor to your favorite pharmacy, and then from there to home. If you do it at the same time, then the transportation company that accepts your trip already knows and they've already budgeted for it. If you're not going to the doctor and you don't have those set up and you're like, oh, can you take me to the pharmacy on the way home? Some companies may or may not be able to do that due to the other volumes that they're doing throughout the day. So to avoid those situations, we recommend go ahead and just adding them to your doctor's appointments. And then if you don't need them, you can simply just cancel them at, there, and that's not a big issue. 45-minute window, we kind of talked about that on the will call. So just remember, if once you call us, the companies do have up to 45 minutes to return to get you from doctor appointments that didn't have a set time. And then this other one is a really good question as well. People ask, well, if they pick me up, how long should I be on the vehicle before I get home or until I arrive to my doctor's appointment? They're allowed the regular drive time that it would take for no stops plus up to an extra 45 minutes. Anything over and above that time would be considered excessive, and you could file a complaint on that. And then also, if you're bringing other people with you, make sure you bring that up. And then if you're not going to keep your appointment, you can call Ride Assist, up to 24 hours to cancel your trip so that we don't end up sending a vehicle out to your home when you don't need them. And I think that's it on the tips. Next slide, I think that might be it. Let's see if I'm at the question point. That's great. So I guess that is that. And the course says it's my terms and use to say, so we don't need to really focus on that. But I'll take any last questions if there's any additional questions that haven't been surfaced. And I apologize. I'm kind of looking at the slide and not looking at any chat questions. So I'm going to rely on my panel if any questions have snuck in that I haven't seen. Is there any last minute questions before we conclude my section?
It looks like that's all for right now. There may be some additional ones that come in at the end of the webinar.
That'd be great. I'll be available. So if they do come in, I'll be happy to address those. Well, that concludes mine. Thank you all for listening, and I'll turn it over to the next person.
Thank you, Thomas. Next up, we have Mike Socha. He's a transit manager for the Central Region of Virginia Regional Transit, and they're our public transit provider for the region. Go ahead, Mike. Mike, I believe you're still on mute. Just a second. Mike, are you able to turn on your mic? So it looks like Mike is having some technical difficulties, so we can actually come back to him in a few minutes if he is able to rejoin us. On the screen, there's some information about the demand response transportation service that serves the region, and hopefully he'll be able to cover some questions or a little bit of a summary for that. Next up, we just wanted to share with you a visual map of the region's transportation options. As you can see from the map, the two shaded green counties have on-demand service with public transit, and the white dots are the in-town transit routes. There are two green lines that represent the cross-locality transit routes that exist right now, the Foothills Express Bus, which goes from Culpeper to Madison and into Charlottesville. That service will take anyone to Charlottesville for any appointments or social reasons, and they will drop them at the address that they need to be dropped at in Charlottesville, and then they can return to pick them up later. The other transit route, which is the Orange Culpeper Connector, crosses from Culpeper to Orange on a regular basis. The schedule is listed under Orange County and Culpeper County here on the right. The volunteer organizations that are operating in each of the counties are also listed. As you can see from the map at a glance, there are many areas that are not covered by public transit, and that's just due to the rural nature of our counties that we serve. We rely heavily on volunteer transportation to make up the difference of that lack of transportation for the individuals in those counties. We have a very high need of individuals, especially aging adults and those with disabilities, that need to travel for a host of different reasons. The primary audience that we serve are trying to attend medical appointments. We have many folks who are also traveling for employment or social or critical errands. And we rely significantly on the volunteer programs to provide rides to those individuals. Again, if people call into the call center, that's that one number where they can call and they can get all of this information on public transit. The mobility coordinators can tell them what transit's available, when it is available, where the stops are, where the closest ending and starting stops are. And they can also coordinate a request to ride with any of these volunteer agencies, or they can direct them to the volunteer agency directly to contact them and work out their transportation needs. So next up, we have Linda Stauffer. She's the board president of Voltran, the volunteer driver program, and she's going to share some information about her experience with volunteer driving. Linda?
Hi, everyone. Good afternoon. I'm Linda Stauffer, and I just really want to take a few minutes today to talk about what it's meant to me to be a driver for a volunteer transportation group, and specifically Voltran. I live in Warrenton, and as I was nearing my retirement in the fall of 2006, I knew I wanted to help out in my community. I was looking for ways in which I could give back. It just so happened that I opened up the local newspaper and saw this blurb about a new program that was forming called Voltran. And it said that they were looking for volunteers to drive seniors specifically to their medical appointments and for other critical errands. So I thought about it and I said, well, gee whiz, I like to drive. I love meeting new people. So maybe this would be a good fit for a volunteer opportunity for me. So I attended the meeting, and right away I said, yes, this is going to work. I signed all the paperwork. I then went to a training session, and I actually took my first drive in August of 2007. And I've just been driving ever since. The great news for Voltran is that we had the opportunity to partner with the FAMS call center back in 2017 when it first opened. And as a driver, what this meant now for me was that it became a much more efficient process for the drivers to get information about ride requests. So what happens every day now is that I receive an email from Marty and Penny, and it basically lists every open ride request for the upcoming 30 days. I happened to look at it this morning because it comes in very early in the morning, even though I'm not up at that time. When I get up in the morning, I get to look at that, and I saw that there were 21 ride requests on that email just for the next 30 days. So as you can determine by that, we're always in need of many drivers. I love to be able to just go in and look at that list. I can pick and choose the ones I can support based on my availability. I look at the distance to and from the client, to and from the appointment site, and I just figure out how much time overall I think it's going to take me to complete that drive. So once I've done that, then I actually either send an email or call Marty and Penny and let them know that I would like to take a specific drive or two. The next step for me is then to call the person I'm driving. And that's really important because that's an opportunity for me to introduce myself. I usually say what kind of vehicle I might be driving. I ask them questions about whether they can get up into the vehicle or not. Some people want a higher vehicle. We're finding out. Some people want a lower sedan. So those are all really important questions and dialogue to have with the passenger that will be driving. We determine, pickup times. Are there any other special things to do afterwards? Do they need to go to the pharmacy? It's all part of the process. Sometimes as a driver, I find myself scheduling 2 to 3 rides a week. As it's turned out for next Tuesday, I'm now ending up with 2 drives in one day because of a rescheduled appointment. But that's what the beauty of being a volunteer driver is. You can pick and choose and make those decisions about what works best for you. Just want to share a little bit about Mary, who I spoke to this morning. I was scheduled to drive Mary tomorrow to her eye injection appointment in Manassas. Well, she called me yesterday and she was just so thrilled. She was like, guess what? Guess what? She said, I got a call. I got a call from a health district. I can go have a COVID vaccination on Friday. She said, it is the Johnson & Johnson vaccine. And for Mary, she was told by her doctor that that was the only vaccine that she would be able to receive based on her health conditions. So what Mary wanted to discuss with me was, could I be her driver? And she wanted to reschedule her appointment from Friday to next week. So I immediately looked at my phone, at the calendar, and I said, here's some days I might be available. Call the eye appointment and doctor and seek an appointment. So we worked it all out. She called me back this morning again to tell me that she's actually going to be given a drive to receive her COVID Johnson & Johnson vaccine, and she is just beside herself in joy to be able to get this vaccine. And then kind of when Thomas was talking about COVID, when COVID first hit, our board looked at this and of course right away decided that we needed to suspend our operations for a 3-month period. We were still getting some driving requests, Marty and Penny were, so we looked at that after that 3-month period, and after we surveyed our drivers, we found out that we had a good handful of drivers who still wanted to drive people. So we said, okay, we're going to do this. So we opened up operations again. Prior to doing that, we established some specific guidelines. We sent those guidelines to Marty and Penny to ensure that they talked those over with passengers calling in. We sent letters out to many of the people that we drive on a regular basis, just to let them know what they could expect. And then we marched forward to make these rides happen. For me, I find out that, I get to drive people from all walks of life. And some have been very blessed with rich, full lives, but then they've had to give up driving themselves because of certain medical conditions. And other individuals have had really a lot of challenges in their lives, and they couldn't afford to have a car and any of the associated expenses. Many of our passengers actually live alone. And so when I get in the car, what I find out is they want to talk. And if you know me, that's an easy thing for me to do too. So it's very easy to reciprocate. We've gone to the grocery store, the pharmacy, to dental and doctor's appointments. I've taken ladies to the beauty shop, gone to the post office. I even went to a court hearing in Winchester where the passenger asked me to come in and sit in the court session with her. That was a big surprise, but I gladly did it. And she sat there, and it was just the most rewarding. She sat there and held my hand, and she just said, "You are my angel today." And those are the kinds of blessings that as a driver you get back from the people that you drive. I've chosen to drive to Manassas, Gainesville, Fairfax, Centerville, Culpeper, and all over Warrenton. Over the years, I've built a lot of relationships with some of these individuals, as I've just talked about, as we share our life's experiences with each other. When I see Mary's name on the list or one of my other regulars, I'm all about immediately volunteering to be their driver. Although my ultimate goal is really helping someone by driving them to and from their appointments safely, I've discovered that being a volunteer driver is just so much more. It's about connecting and building relationships. While my passengers are grateful for the ride, it brings me a lot of joy to know that I've helped someone else. And I bet if you ask any other driver of any of our other volunteer programs why they drive, they'd reply in a very similar manner, that they are helping someone. It brings them great joy to do so. So my plea or my challenge, I guess, is personally, we'd love to have you join our organization as a volunteer driver. And specifically for Voltran, I'd love you to contact Libby. Her number is on the screen up there. And she will meet with you and get you started on this journey to be a volunteer driver. Hey, y'all, thanks just for listening. I appreciate it.
for now, we're going to actually jump back to Mike. I think his microphone is working now to talk about demand on response service.
Can you hear me now?
Yes, sir.
Okay, very good. Well, thank you very much. Sorry, technical difficulties. It's raining outside. Well, Virginia Regional Transit, my name is Mike Soa. I'm the transit manager here in the central region. And we're very excited to be involved with you, Kristen, in the regional collaborative efforts that you're working. And we really do appreciate the opportunity to speak. I want to give you a little bit about VRT being a 501(c) nonprofit agency. And our mission is to provide affordable transportation service through system management and other related services. And VRT is a recognized leader in rural communities, and we can provide solutions to a number of things involving transportation. Our central region is one of our 5 regional programs that VRT manages throughout the Commonwealth. And central is comprised of several programs in this Rappahannock region, which include the town of Warrenton, the circuit rider programs, where they operate the blue and the gold on a fixed route deviated service weekdays from 7:30 to 7:30. Saturday service from 9:30 to 5:30 called the green. Fauquier County is our demand service with advanced day and up to 2-week reservation. And the Fauquier demand, we work on trying connectivity with the circuit rider throughout the week. And service on that program is available from 8 to 5 weekdays only. Within the town of Culpeper, we operate obviously the 2 town trolleys, weekdays from 7 to 6:20. They're called North and South. And Saturday service is also available from 8:20 to 2:20. Within the town, we also operate the Culpeper demand service. We operate 1 bus specific to in-town service with a focus on our ADA consumers within the town limits. Service on that program is available Monday through Friday from 8 to 4:30. Reservations are taken up to a day in advance and up to 2 weeks in reservation. In the county of Culpeper, we have 2 buses that are operating. County 1 operating from 7 a.m. to 6 p.m. Monday through Friday, and County 2 from 7 to 1. And the County 2 over the last year has actually been providing mid-afternoon trips to connect with the Virginia Breeze at Brandy Station Park and Ride through a partnership with VDRPT. We're real excited about as things begin to open up. And I heard Mr. Garnett talking about that. As things begin to open up, we're beginning to see usage of that. The town of Orange, you go to the south, we operate the trolley on behalf of the town of Orange called the Toot, weekday service from 7:30 to 5:30. And that also provides a deviated fixed route to help meet the demand of our ADA consumers in that region. They also have Saturday service with the Toot, including a connection to Gordonsville. And Saturday service operates from 8:30 to 3:30. In Orange, Gordonsville, we have a commuter service. That's a demand service. It begins at 5:15 in the morning till 9:15 a.m. and afternoon service from 11:15 to 4:15. That service is only available Monday through Friday. We have another service, Orange to Culpeper, the connector. It's a fixed route program that operates weekdays only, 7:15 to 11:15 and 2:15 to 4:15. There's no weekend service on that program. And that specific program, we do a lot of connection in the Culpeper region via transfers at our Culpeper Hospital and soon to be the Culpeper Depot as well, trying to eliminate some of those transfers in between. You've heard a little bit about the Foothills. The Foothills Express is a route program. Reservations are taken a day in advance and up to 2 weeks in advance. It operates only on Tuesday, Wednesday, and Thursday. And the operation hours are 7:30 to 1:45 and 2:15 to 5:15. The service originates from the town of Culpeper with stops along the way to Charlottesville and Madison and Ruckersville. Now, there's a bunch of additional information about the programs here in the Central Region. Right now, our reservations are taken for our demand service a day in advance through our dispatch office and can be made up to 2 weeks in advance. And we have dispatch that is here from 7 a.m. to 7 p.m. Monday through Friday, and they're also here from about 8 to 3 on Saturdays as well. Medical trips on some of our consumers, well, sometimes they get released a little bit later than their expected time of arrival, but we make it a priority and have been not to leave anyone stranded. So I know that question came up earlier. We know that they're out there. We know their names. We know we're going to do everything in our power to get them home. Our ADA consumers within our fixed route areas, the Toot, Culpeper and Warrenton, they are required to complete a service application, and we use those, and we also issue them an ADA certification card. And anyone in a PCA, personal care attendant, with that consumer can ride free on all the programs. Recently, VRT, in a partnership with Shaw Scheduling Software, has installed tablets on all our demand buses. These tablets are going to help provide real-time information relating to cancellations, no-shows. We can group better, we can give ETAs better, we can give route mapping to our staff better. And in theory, it's going to help provide a more efficient scheduling tool for all the community residents and take a lot of the guesswork out. I'm also happy to report that we have a real-time GPS tracking program on our website, and we're directing passengers now that they have the ability to see the exact location of the fixed route service and plan accordingly. And they can also download this on a mobile app, and people have been pretty impressed by the use of that. All bus fares have been suspended since March of 2020 when the governor instituted that. So basically all rides are free throughout this region. And if you go to our site, I can tell you that the highest amount of fare that you're going to pay is about $1, and the least is going to be about $0.25. We do take tokens, and we do sell tokens, and tokens have been issued throughout the year. Buses all have shields on them. So drivers and passengers are separated by that. Mask usage is required to ride on all our buses through the FTA and the U.S. Department of Transportation. We're limited to 50% capacity. We went through a 6-foot social distancing to 50% capacity, and we're adhering to that. Our wellness checks are done on all our drivers prior to driving. Our fleet is disinfected throughout the day and following the same day service. We have provided uninterrupted service through this pandemic, and our dispatch office is handling over 3,500 weekday phone calls a month. And any additional information having to do with this presentation can be obtained by calling my office at 540-825-2456 or visit us on the VRT website. Kristen, I think it's great that you set this up. We're so pleased to be a part of it, and I'll take any questions, or anybody can contact me at mike@vatransit.org.
Mike, we actually have one question, if you'll hold on for a second.
Yes,
They
ma'am.
are asking about the demand response schedule in Fauquier. If you could just go over that schedule availability, the times and dates.
Yeah, Fauquier County demand, where is it? 2-week reservation. That service is available 8 to 5 weekdays only. There is no weekend service. And what we're trying to do with the Fauquier demand is provide them that shuttle from the county into the town, but most times we're able to connect with the blue and the gold. We've actually set up a second transfer site at the Food Line in Warrenton. So there, you've got one at Key Street, you have one now at Food Line, and it's been a really win-win situation where people can come in from the county, they can connect with the circuit rider, go about their business, and reconnect with the Fauquier County demand to go back home. So a day in advance and up to 2-week reservation.
Great, thank you.
Yes, ma'am.
And I'm actually going to jump back to Linda. We have a question about Voltran. The first question is, are there types of consumers that Voltran prefers not to drive? And this person is also asking, what hours does Voltran operate?
Well, Voltran services individuals in Fauquier County, Rappahannock County, and Northern Culpeper. We typically have been operating in daytime hours, Monday through Friday. However, just last month, our board voted to expand our hours of operation to include evenings and weekends. We depend on Marty and Penny a lot. They screen all the phone calls that we get. And if they determine that Voltran is the right organization to transport the client, then they'll send out the ride request to us. So while our targeted audience is seniors 60 and over, and anyone of any age with a disability, we can also take people who are just in need of transport to a critical appointment. So hopefully that answered the two questions.
Okay, and I just wanted to add that Voltran also does have some limited wheelchair transportation options as well.
Yes, that's thank you, Kristen. That was important to mention.
Next up, we have Sue Davis, the Volunteer Recruitment and Outreach Coordinator for Aging Together, back with us to talk more about the volunteer driver programs in the region and how to become a volunteer. Sue?
Thank you. It's very easy to become a volunteer. Right now, you can see on the screen that there are a group of different transportation services available, and some of them overlap. You know, you're always welcome to drive for more than one. It's easy. And this information, once again, will be available on regionalcollaborative.com. And if you're looking at this on the TV, on the local channel, you can always call me, Sue Davis, at 540-505-5900. And any information that you want to ask, I can get you in touch with the right person. But Linda and Thomas, and actually Mike, they all hit on it, that during the COVID, it's been pretty challenging finding volunteers, but it hasn't been impossible. All of the programs have sanitary and disinfectant rules in place, and it changes as the time changes and things get better. Or if they get worse, then the sanitizing and everything is upped even more. But all these groups, you contact those numbers that are on there, or once again, I will give you the number if you contact me, and you can sign up for any program. We have one volunteer that drives for Rapid Home, Voltran, and Caravan. I'm a Caravan driver, and so when I go out to ask for volunteers, the one thing I tend to get is I get the person who says, oh, I'll drive maybe once or twice a year, or I get the person who says, hey, I'll drive every day. Well, actually, we want somebody middle of the road who knows their schedule, who knows their limitations, who wants to drive and can say no. If you can't say no, you're going to burn out. So our volunteer requirements are age 21 and over, valid license, valid insurance, and you will have a background check and a DMV check. And when you become a volunteer driver, you can look at all the agencies. If you're not sure where you want to drive, you know, give me a call and I will hook you up with the right person. I had somebody who called me and wanted to drive for Voltran, but they wanted to do Caravan driving because they wanted to drive wheelchair. And they didn't realize that Voltran had a wheelchair van. So they were able to go ahead and drive because they lived in Fauquier County. And when you're a volunteer, there's different training. Once again, the wheelchair training. There's plenty of opportunities. You will receive an ID badge, vehicle magnets, and flexible scheduling. Because if you live in Orange and you just want to drive in Orange, we are going to honor that and just give you, let you choose from Orange trips. And what Penny and Marty do, it's easy to see the different trips. Penny and Marty, they send out an email to every driver that has where, it gives the date of the appointment, it gives the time of the appointment, the name, the address of the client, and then it tells you where they're going and any pertinent information so that you can make a good decision. Sometimes there'll be a procedure, sometimes there won't, but Penny and Marty will always put that down, and then you can make a wise choice about whether you can take that ride or not. So volunteering is easy. Once again, if you want to give me a call, Sue Davis at 540-505-5900. I can refer you to any program that was mentioned or on that slide. And, you know, it takes sometimes a little bit to see where somebody really wants to drive and hook them up with the right person or the right service.
Thank you, Sue. Next up, we have Lola Walker. She's a Nutrition and Volunteer Services Supervisor for Rappahannock-Rapidan Community Service Board. And she's going to talk a little bit about some of her other unique volunteer programs and some upcoming programs.
Hello.
Lola?
Hi. Can you hear me okay?
Yes, ma'am.
My video is not working. I've had an issue with this, but I do want to say it's so wonderful working with all of these folks and all of these different transportation programs in our 5-county region. I've really enjoyed getting to know everybody, and we all help each other. So I think that's the collaboration piece for sure. I don't see Caravan up here, but I do want to talk about Caravan a little bit. Caravan has been in existence since 2003. We've provided between 500 and 800 rides per year. Maybe not during the COVID year, but we have been able to do that in the past. We are definitely looking for new volunteer drivers to help us. And like Sue said, you're welcome to drive local. Wherever you say is the only places we're going to ask you to drive. We've been very fortunate, thanks to Sue, of getting 5 new drivers in the 5 counties of Culpeper, Fauquier, Madison, Orange, and Rappahannock County. And we're very excited about that because many of our volunteers have aged out or they're not able to drive due to COVID. So Caravan is a program that we had received some grant awarded minivans that we got modified. So they not only carry and transport people who are ambulatory, but we can also provide wheelchair transportation. So it is a modified minivan. It's easy to drive. The ramp is portable. It's not a lift. It's very easy. So we tell our volunteers how easy it is so that they'll come and check it out for sure. We do an orientation process. And of course, we have our security checks in place like Voltran and all the other programs. So we do have a volunteer opportunity in all 5 counties for volunteers to provide meal delivery to our senior centers. We have 5 senior centers that we run through Rappahannock-Rapidan Community Services. So the volunteer would come from their county, say Rappahannock County, and they would come here to Bradford Road in Culpeper at our central kitchen, pick up the daily noon meal, and bring it to the senior center. It's a great opportunity for folks that want to do something in the community, but maybe aren't as social as you or I. So RapMed Rides and Rap Rides have been around a long time too. I was on the original committee for that. We had met with churches and different volunteers in Rappahannock County and developed these 2 programs. RapMed Rides is like it says, we provide transportation for medical and legal visits. Darcy Canton, who is the Rappahannock Senior Center administrator, actually coordinates that program along with Rap Rides. Rap Rides is a once-a-week errand running type situation where 1 or 3 people make carpool to Front Royal or Warrenton or Culpeper and run errands. They may have lunch. They may spend the day together. They really, they get together and they have a good social time. So, and then on the right, we have our new pilot program that we are organizing at this time. It's not been put forth yet, called Rappatran. The way Rappatran is going to work is people will call Penny and Marty at the FAMS call center. If we're not able to provide volunteer transportation for them, we'll have this option for them also. Rappatran will have paid drivers who will charge a very small, affordable fare. And we do cross county lines. Charlottesville, Fredericksburg are very popular. People need to get to those places, the Fontaine and Pantops and different areas in Charlottesville and Fredericksburg. So we'll have this person available, and it'll be a first come, first serve process. But fares run from $5 locally in the 5 counties to $10 for Charlottesville. And these are round trips, to $20 for, say, a Richmond trip for a VA hospital or such. So these are some of the things that we're doing at Rappahannock-Rapidan Community Services. And I work on the Area Agency on Aging side. And so our focus definitely is for people over the age of 60 or a person of any age with a disability. And if you have any questions, feel free to call me. My number is 540-825-3100. I'm extension 3358. And I do want to emphasize that volunteer and rider safety is our #1 priority. And we take that very seriously. So feel free to call me or ask me a question. Thank you so much.
Thank you, Lola. That brings us to the end of our webinar. We will open up the panelists to have answer questions in just a moment. I just wanted to touch real quick on what was on the first slide, that this webinar was produced out of a partnership that was formed from the Regional Transportation Collaborative. That is a new program, a new mobility model that's been put together in our region, and it is bringing together traditional and non-traditional stakeholders. The program is actively involved in trying to engage new members and engage with current members to try and create a dynamic and complex partnership that creates cohesive mobility solutions that are mostly targeted towards aging adults or individuals with disabilities, but that also serve the community at large. The RTC, or the Regional Transportation Collaborative, has a host of services and resources available to the members of the community stakeholders. The services are project implementation, strategic and long-term planning, resource leveraging, complex data analysis, funding sourcing, service coordination, mobility management, and efficient programming. We are dedicated to working together to try and implement new programs and try out pilot projects that all work towards supporting the needs of the community and increasing access to mobility in the region. If you have ideas or are interested in getting involved or partnering, you can contact me directly. My information is on this presentation, or you can look at our website and contact us through that, which is regionalcollaborative.com. We're excited to introduce all of the new programs and initiatives that we're planning, and many of them will be effective in the community over the summer. So stay on the lookout for that. That brings us to our question portion of the webinar. And if you have questions, again, you can type them in the chat. If we don't get to them today, you can email any of the presenters directly, and we will get back in touch with you. One question that's come in for all of the panelists, anyone can feel free to answer this, is from Ellen Phipps. It's, are there any unmet needs you are seeing in services for older adults? For example, weekend rides or rides to non-medical or other. Do any of our panelists want to take an opportunity to answer that question?
This is Tom with Motive Care. We do see that some of the challenges are for the trips, and I'll just share this. And this is not just for the elderly community, but for the community at large. Is that if you have flexibility on when you need the transportation, sometimes picking the right time can make a huge difference as far as availability of resources. For example, for medical appointments, if your doctor is flexible and maybe can see you between the hours of 10 and let's say 2 p.m., that's the time of the day where most vehicles are a little bit of a lull or slower time for them. There's a lot of transportation right at the start of the day, like from 7 to 9. And then a lot of the day programs in Dallas centers, they start, having people go home like between 2:30 and 4. So if you do have flexibility in setting up your need for transportation, that certainly will help put more resources available at the time that you need it. And I do realize that not everyone has that option, but if it's always good to check with your doctor or the facility that you're going to, just to see if they have a time between 10 and 2, and it would probably most likely increase the availability of your resources at that time.
I'd like to add to, he hit it right on the head there, especially with volunteer transportation. Volunteers do not want to get up at 4 o'clock in the morning to run somebody to the doctor at 7. As Penny and Marty, I'm sure, can tell you, that's a tough one for us to fill. So the 10-2 is a great time period for volunteerism also.
Yeah, so I think what we're talking about is just flexibility on both ends, from the provider to the person who is asking for transportation. If they're able to try and change timeframes or dates, that can also help to find more rides. Allowing for that flexibility across the board from all of us is really helpful. We've started trying to present more data to our medical providers directly to show that there is an opportunity there for them to potentially schedule folks with transportation needs in ideal or preferred time slots. So Penny and Marty are great coordinators for mobility. They are able to really look and analyze the requests that come across and try and make recommendations to the client or person who's calling in, and then also really try and work with volunteers to fill any unique or challenging needs. We will often try and find some kind of support, and it is rare that we will leave an individual without any type of transportation support.
Kristen?
Any other panelists wanted to provide?
I did.
Sue, go ahead.
I did want to tell you that recently we had someone who needed to get their COVID shot, and I contacted Penny, but the problem was the lady had some sort of dementia starting, or the people at Germanna didn't know how far along it was, and what they needed was someone to keep this lady apprised of her appointment and then get her there, and just she needed extra attention. And Penny tried as hard as she could, and she did find a driver who would take her, but he didn't want to do it by himself. He wanted another driver to go along, and we're having problems filling numbers anyway. But for me, what happened was this woman needed a little more attention than just her COVID shot. So I contacted that county's coordinator, and that county's coordinator got involved and has reached out to this woman. She has no family in the area. She has no caregiver. We're not sure where she stood with the dementia. And it's just that there are some heartbreaking calls that come in that you can't just let go. And that coordinator, thankfully, reached out to her and visited her. And I'm not really sure what happened with her COVID shot, but this lady needed more help than just a COVID shot.
So that brings us to the Regional Transportation Collaborative Partnership that was formed at the end of 2020. The beginning of 2021, we have been working to try and form new partnerships that help address these non-traditional needs. We frequently see unique or challenging mobility requests. We've seen the whole gamut, and we collect a tremendous amount of data on those requests to try and analyze and figure out what types of needs and supports can really make a difference. With that, we have partnered with the PATH Foundation to connect individuals that have unique needs with their community link, which they have offered through their foundation. They have an individual who is our contact point. We can submit case files or advocacy cases to her directly, and she can contact those individuals with these unique or additional needs that we identify through our conversations with them. And she can follow up and help them with planning, with figuring out how to contact the appropriate folks to help their needs. Any kind of issues that they're having, she's going to research and try and figure out what the best choices are and try to connect folks with the options that may be available to them. So Penelope at our call center is our accessibility advocate, and she works closely with the Community Link and tries to refer cases. So if you have unique individuals with unique needs, we are ready and poised to be able to refer them to the right location and kind of go above and beyond to try and support their needs, not only mobility, but really trying to close the loop and get them the wraparound services that they need. Anyone else have any other comments they'd like to share?
Yes, I would, Christian. I agree with Sue. We get a lot of heartbreaking calls that come in and a lot of interesting stories. I always try to do our best to, put them with the right choice of transportation needs that they require. I had we do special requests as well, Christian, as you know, and Lola. Today I had someone call from Fredericksburg that was a homeless person, stranded in Fredericksburg, for instance, didn't have a ride back home, which she lived in Culpeper at the hotel here. And she was just lost. She had no family, no friends around in the area. So one of our drivers, our caravan drivers, agreed to help this lady out. And he is just wonderful. And I have to say that a lot of our drivers that we have, thanks to Sue, are just wonderful people. And they do go over and beyond to help people. So I'm very thankful that we have such a good group.
Thank you, Penny. Yes, Sue and Libby are our volunteer recruitment staff members that work really well in the region at recruiting drivers across the board. They will refer anybody who is interested in volunteering to the appropriate programs, and they work closely with the volunteers to make sure that they understand the flexibility of the programs, what's available to them. And we really have been very fortunate and able to bring on some really amazing volunteers that go, above and beyond and help with these unique cases. We also partner with many other organizations outside of our region, as Penny mentioned, and we will try and get charity rides for folks that kind of fall into these unique needs, or any other issues we will try and resolve transportation-wise if it's connecting them with another transportation system or whatnot, a volunteer who can connect them to a transportation system in an urban or semi-urban area as well. So we definitely go above and beyond with our volunteers and our services to try and meet as many needs as possible. And anyone who needs data or information or is interested in the stories or unique mobility issues that we've seen in the region, you can contact us and we will provide you with data. We keep a tremendous amount of information, and we're able to pool statistics and data for grant purposes or for community conversations. So if you need that information, please feel free to reach out to us. Anyone else interested in commenting before we end the webinar? Okay, I'd just like to thank all of the panelists and attendees. Thank you for being involved with our webinar. And as you can see, all of the information, accessible information instructions are here. And we will be re-advertising this webinar recording for the end of April. So if you see this come back across and you've already participated, Please don't feel like you need to watch this again, but share it with any of the individuals that you come into contact with or work with that may benefit from this information, and it will be republished to the public in April. Thank you for all of your support and your interest in this topic.
Thank you.
Thank you.
Thank you.